Is the FDA approval of the COVID-19 vaccine illegal, and does a doctor prove the Pfizer informational insert with its vaccine shows criminal regulation violations? No, that's not true. The claims made on the Stu Peters show by a guest without a medical degree are recycled conspiracy theories and false claims about the COVID-19 vaccine that Lead Stories has previously debunked. There is nothing to substantiate the claim that vaccine approval is illegal. The claim appeared as a video published on BitChute.com on August 24, 2021, titled, FDA Approval Illegal. Doctor reveals Pfizer insert proves criminal regulation violations, which opened, quote, "It's a sad state of affairs knowing that we have to have conversations like this on the 23rd day of August 2021. End quote. Users on social media only saw this title, description and thumbnail, quote, "FDA approval illegal. Doctor reveals Pfizer insert proves criminal regulation violations. Donate and support my work. https://earthnewspaper.com/index.php/donate Stu Peters. http://stupeters.tv Dr. Jane Ruby. https://drjaneruby.com Stu Peters Archive. https://earthnewspaper.com/?s=Stu plus Peters FDA approval may give lawyers. End quote. Peters begins the show on another topic, talking about the highly questionable election that took place that was stolen on the 3rd and 4th of last year. This is false. The election was not stolen. Donald J. Trump lost the 2020 presidential election to Joe Biden. Trump received 74 million votes to Biden's 81 million votes, and Biden received 306 Electoral College votes while Trump received 232 Electoral College votes. Jane Ruby, a guest on the show, identifies herself as a nurse practitioner in the video, not a medical doctor, although the headline on the post refers to her as Dr. Jane Ruby. Her Twitter account was suspended as of August 24, 2021. Lead Stories has debunked previous false claims made by Ruby here and here. Ruby holds up to the camera a piece of paper with yellow highlights and says, quote, "What I'm holding in my hand is what we call the prescriber's information or the package insert. This document is supposed to contain all the key details from the study. The pharmacokinetics, how the drug behaves, where it goes, how the body eliminates it. All the safety data. This document is so paltry. In my estimation, the FDA itself has violated its own federal regs, and in this situation the FDA is committing crimes." End quote. She appears to be referring to the fact sheet for healthcare providers administering vaccination providers, which includes the full emergency use authorization (EUA) prescribing information, according to the FDA website. This document was updated on August 23, 2021, the day the Pfizer-BioNTech COVID-19 vaccine was given full approval from the FDA. However, Ruby never states which specific, federal regs, and/or laws purportedly are being broken and therefore what crimes are being committed by the FDA. She claims there are at least 20 crimes in the insert for the Comirnaty, which is the brand name for the Pfizer-BioNTech vaccine, but offers no proof of crimes, and just repeats false information about the vaccine. At 19:02 in the video, Ruby says, quote, "They approve it for the SARS-CoV-2. We know. We've been talking about this for weeks. No one's ever isolated or shown the proof that it's been isolated from a human being or in a human being." End quote. This is false, as Lead Stories previously reported. Clinicians and lab researchers working to stop the spread and to treat the most stricken of the millions of Americans infected so far with COVID-19 rely on the study of the virus. The SARS-CoV-2 virus has been isolated and its means and ease of transmission have been proven by multiple scientists working independently of one another. For examples, see the Centers for Disease Control and Prevention, CDC, footnote list of research papers. At 23:19 in the video, Ruby claims, quote, "We've had, as far as I know, worldwide we've probably had over 500 deaths in 12 to 17-year-old children from myocarditis or some kind of cardiac event." End quote. This is misleading because the number of deaths of children 12 to 17 in the United States from myocarditis, inflammation of the middle layer of the heart wall, is 0, according to the Centers for Disease Control. The CDC explained that it researched all of the claims of adolescent adverse effects from the vaccine using VAERS, the Vaccine Adverse Event Reporting System. VAERS is a publicly accessible tally of unverified notes about any health event people experience after they are vaccinated. A CDC report titled, COVID-19 Vaccine Safety in Adolescents Aged 12 to 17 Years, United States, December 14, 2020 to July 16, 2021, was published on August 6, 2021. Quote, CDC reviewed 14 reports of death after vaccination.